Hi everyone, I'm having another COVID hairdo. I didn't drive my hair, and so here we are, COVID hairdo in style. I have an amazing chiropractor. Her name is Dr. Suzanne Chavez. She's joining us today. We are going to be looking at how our spinal fluid and how the muscles and our bones, all of that, how that relates to energy flow. So I'm really excited to have her today, and she's also going to demonstrate for me on this amazing gadget that I'll let her explain. And I've been using it at home and really like helping, like, because you can't get a massage right now, right? So you're just going to sort of push down on it on the different spikes, and it's incredible. So she's going to demonstrate it, and we're going to be giving one away for free. So follow the instructions on my Instagram or her Instagram, and then we can go from there. This is her first live, so she's going to be joining us very soon. I'm just trying to see, as soon as she hits request, then I will get her in. So she's a chiropractic doctor, and she's going to be teaching us how to give ourselves a massage, how to work on our own cerebral spinal fluid, why that's important, and what happens when we're in pain and what we can do about it. Okay, here she is joining us. Don't you guys love these Instagram lives? Hi!
Hi!
You made it!
I did it!
Awesome, awesome. Are you at your office right now?
Yes, I am.
Yay. Okay. And I'm excited. I've told everybody about the giveaway, but I'm going to let you talk
Cool.
about that a bit later on.
Okay.
So Dr. Suzanne Chavez, chiropractic doctor, healer, just an amazing, I'm going to be getting a treatment from her soon. So I'm really, really excited about that. Doctor, treat thyself, like we have to take care of ourselves so we can take care of everybody else.
Absolutely.
And so I wanted you to start off by maybe explaining a little bit about, what does a chiropractor do? Because a lot of people think that chiropractor just like adjusts people and snaps them. And I know for a fact that's not the only thing they do. Obviously, they're realigning, but chiropractors are incredible sources of support for patients, and why it's so important for your spine to be supported, and how the muscles can go out of whack, and what can that do to your flow. So I'd love you to give everybody a chiropractor one-on-one and on exactly what you do as a chiropractor.
Okay. So basically, like, chiropractors are kind of unique in the sense that we really have like a greater understanding of the musculoskeletal system and how the anatomy is integrated into the spinal column and the extremities, and how all of that works together. So in school, I actually worked on a cadaver for a year, and it was purely just to have a learning and an understanding of the muscles, the nerves, the blood supply, all of that. I mean, 1 year we spent on a cadaver. It was insane. We
you know what? It's so
from
weird.
The outside in, and I don't think people realize that.
Well, I went to naturopathic school in Toronto, and we shared the cadaver lab with the chiropractors. So we worked on the cadavers for a year as well.
Yeah.
And so our training is very similar in that way, where we're being, constantly, examined on this, and there's little flags put on the cadaver, and we have to figure out if it's like a nerve or artery or vein, and it's like.
I'll never forget, like, the first test, we walk into the lab, it's all of our cadavers, there's a teeny tiny push pin with a flag, and it's like, what is this nerve, what is the function, and how would you diagnose this, and what would it manifest like in the body? And I mean, these tests were like 150 questions, and you had 2 minutes to identify, answer, and move on. So we definitely have a vast understanding of the anatomy. I mean, I work with a lot of other doctors, and I think one thing they're always impressed with is our knowledge of anatomy. And that's just something that we integrate on a regular basis. But specifically, doctors of chiropractic integrate a chiropractic adjustment with their treatments. That's our like specific, unique specialty. Obviously, doctors of osteopathy, and I think you guys learn manipulation as well. I have a couple of doctor of physical therapy friends. Everyone learns it, but I mean, this is like truly what we hone in on as our skill. And so basically, the chiropractic adjustment induces motion into the spine. And it also, the whole idea is to just integrate flow and homeostasis into the body. And what does that look like? Healthy circulation, proper flow of nerves so that the communication from the muscles to the brain to the body are all communicating. Everything is flowing. So it's like if you look at like a freeway, if there's traffic, if things are getting backed up, a chiropractic adjustment can help realign or release that flow and allow the body to do what it needs. Because the beauty is, like, I truly think of myself as a facilitator. Like, I'm just identifying areas in the vertebrae that specifically aren't moving. And by using the chiropractic adjustment to specifically create motion in that spine, in that part of the body, your body can naturally do what it needs to do. But if it's not getting full circulation, if the nerves aren't communicating, or if they're over communicating, that manifests as disease and illness and pain in the body.
I love that. That's brilliant. I mean, it's a brilliant way you explained it. And, you know, these are also blockages in the body.
Of course. Yeah.
Right?
And so acupuncturists work in the same way. I mean, we're all just trying to restore homeostasis. We're all seeking balance, mental, spiritual, energetic, physical balance. And one of the like interesting ways to describe it to my patients who are just like, you know, what's chiropractic like? You guys just pop people and like we have to keep coming back and we get addicted to the pops, and like I can pop myself, like I'm at home and I can like do things and hear the popping sound. And I just like, I mean, aside from being horrified, it's like, well, no offense, but I'm like properly trained. I went to college for 8 years and, you know, I practiced in a student clinic and I did my diligence, but you just have to think of it like in your car. If you don't align your tires or you don't check your oil, what happens? It starts to run ragged. If your tires aren't balanced, you wear the tires unevenly, you'll go through your brakes faster. The steering wheel will start to veer off and you're like, what is happening? You see like smog coming out of the pipes. Like all of this relates to the body. If everything is properly aligned, you'll feel well. Your blood will flow, circulation will flow, you'll look good, you'll feel good, and you'll have mental clarity, you'll have all these things.
Why do we go out of alignment? What happens to us where we go out? I mean, I kind of know some of the answers, but I'd love to hear it from you as being the expert. Where do you see people actually going out of alignment? What are they doing in their everyday?
Okay, so I just think like in general, because my patients always ask me this too. They're like, do you ever find someone where like you literally don't have to adjust them? And honestly, there are times like I have patients who I definitely do not adjust. But in general, we all do have some misalignments. Like when we're born, our spines aren't perfectly symmetrical. I personally have scoliosis. I was born with that.
Right.
So I naturally need more corrections because my body isn't aligned properly. So yeah, I mean, most people do need adjustments, but what happens is something repetitive or traumatic, some sort of force or repetitive behavior created an imbalance, usually in the spine, which creates imbalance in the muscles, which then will manifest as inflammation and pain.
Makes sense.
And so if you're feeling pain, then more times than not, there's some sort of imbalance either in the muscle or in the structure. And that's why you're perceiving the pain. Or if you just feel like things aren't, you know, lining up, like my patients are like, I feel like I have a short leg. And they do. They actually do have a functional short leg because their body is so wound up on one side. And they
what
can see it in
happens?
their shoes and their pants, you
Is it
know?
because of the way they're sitting on an ongoing basis and that muscle tightens up and you can release that over time? And
Yeah, so like most men come in with a lot of pelvic misalignments because they sit on their wallets. I mean, imagine if you're constantly sitting in a car like this, what that
who
does
sits
to
on
your
their
skeleton.
wallet?
I'm trying to change the world by making all my male patients take their wallets out of their pants.
Get a man purse. Get a man purse.
I know, I'm like, do the man bag. I don't know what to tell you. But also like women, we're always like crossing our ankles, we're crossing our legs. Like all of that creates tension.
What
We're
about
full
high heels? High heels.
Oh my gosh, high heels, don't even get me started. It's just all these things we do to our bodies. So if you're not like looking in the mirror and standing barefoot and being mindful of your body position, imagine what you're doing that isn't perfectly symmetrical.
Right.
And like, not to make you feel crazy, but like most people aren't mindful of the things we do. We always hold our phone in one hand. We tend to like look at the TV in one direction. You know, there's so many things. Many people are like posture. If you have like big breasts, you're gonna tend to like really like hover forward. I don't personally have that problem. I have the big butt, so I'm always trying to like hold that thing up. You know, like everyone has their own struggle.
What if you have both?
Then I mean, you're kind of better off because then you're just sort of like forced to be somewhere in the middle.
I love it. I love it. Yeah, it's kind of cool because I haven't worn any high heels because I mean, my shoes are like, where did you go? Are you alive?
You're like, Nigma, we love you.
There's no point in even wearing any shoes anymore. So those are really interesting points. And do you get to ever, I mean, I get to see how I can tell by looking at people's skin and their face and like any kind of bloating on their face, what they're eating. Do you feel the same way when you're touching their body? Can you feel like if they've been eating sugar or bad food or gluten, can you feel the tissues? Because I know I can feel tissues when people have been eating naughty things.
Yeah, I mean, 100%. I actually relate a lot to some of your stuff in your books because I see the pictures, you know, and I mean, of course, it's like, did you ever watch that movie, What Women Want, with Mel? Oh, I can't think of the actor, but, you know, he's like tortured by all these voices in his head because he can hear what women are thinking. Well, sometimes I feel like that because when I'm out in public or when I'm walking around, I'm looking at how people are walking or I'm looking at, you know, the way their pants are or how they're wearing their shirt or, you know, a lot of people have like head tilts and it's like untreated torticollis from when they were kids and they just didn't know how to treat it. But to answer your question, yes, on the skin, when I actually look at my patients' backs, more times than not, it's pretty interesting because it correlates to what you see in people's face when you do your beauty treatments. Generally, if there's a chronic area that needs to be adjusted or that's causing or being inflicted by stress, I'll notice like a little, like almost like a back pimple or just a discoloration. Like it doesn't look really like, you know, when you're youthful and everything's good, it's like nice and rosy colored and it looks like it and feels, you know, squishy. So it will feel rigid, almost like jerky, you know, or ropey. And you will have like a little bit of skin irritation around that area. So totally, you can see it even without touching it. I can, you know.
Interesting. Yeah, because it's sort of the area where, and also like the areas of the face where you're having, you know, like acne and stuff that's like hormonal, things like that. Sometimes back acne is related to the same kind of hormonal area here. So it's super interesting, you know, what you're eating will affect how your muscles, your nerves, your blood vessels, everything.
Oh, yeah.
What do you have like 150,000 miles of blood vessels? Like, no, it's not 150, it's 60,000 miles of blood vessels.
60,000 miles, yeah.
60,000 miles.
Insane.
So the microcirculation is insane. That is the most important part is the microcirculation and then the elasticity 100%. Of the blood vessels, which are affected by nutrients. Absolutely. So that then affects the muscles, which then affects the spine, which then affects your posture. And then, you know, even people are will sort of move depending on what kind of mood they're in. You can tell somebody's uptight if they're, I have this problem. I'm always shrugging up, which you'll see very shortly. My issues, but yeah, it's super interesting. So basically, would you say that your body talks to you? Your body is telling you when it's not happy, when your muscles are tight. What causes muscles to be tight? What is like that mechanism of action?
Yeah, so basically in the body, we have things called like the Golgi tendon and muscle spindles. And how I kind of relate it to my patients, because it's pretty complicated, is that, spiders form a spider web.
Right.
And they interweave all these different layers, and then they sort of sit on the edge and they wait for like a fly or something to come in. And so what they do is when the fly flies into the spider web, they feel this reverberation through the spider web onto wherever else they're standing. So what happens is over time is if you have some sort of imbalance, if you have inflammation, which is causing swelling, which can create tension, if you don't stand well, if you don't have good posture, gravity is putting pressure. So it's like this intertwined entanglement of fascia and muscles. And the Golgi tendon over time feels this chronic tension. And so it begins to create like a brace in the body. And so it will literally shorten down and it will put pressure on the edges of each of the muscles, so on the insertion and the origin. And that actually creates tension on the joint itself. And all of our joints in the body have this vacuum phenomenon, which means every joint has this little pocket of gas and synovial fluid. And when that is compromised or put pressure on, it doesn't allow for full blood flow. It doesn't allow for the full contraction of the muscle. And over time, your nerves can become overstimulated by that lack of full motion. And so you'll either experience like numbness or decreased sensation, or like if you're like when your hand goes to sleep, things like that. Those are like over time it can manifest as like nerve symptoms, or you can be hypersensitive and just be really, really tender to touch, which is the muscles just really guarding the body down, which it's protecting the body, but ultimately you need to have that all released to restore function.
You get people that have really hypomobility and then hypermobility.
Yes.
And the hypermobility is almost as a result of the hypomobility.
Exactly.
Which is must be so crazy for you to work with, because hypermobile patients should not be doing yoga and stuff like that.
Totally.
And, I have a lot of patients with hypermobility and stem from an autoimmune condition. And when you clean up the diet and you send them to the right chiropractor, it's golden,
Yes. And that's what people don't understand. Like I have patients who have like Ehlers-Danlos syndrome.
Yes.
And they're like, they have a connective tissue disorder. They're hypermobile. They're also super sensitive, and they've, been mismanaged or just haven't been seeing the proper care. Like you should really never adjust those people. I mean, it could really, really damage them. And so it's been a struggle to try to help them, because when they come in to see me, they're like, well, the adjustments are the only thing that help. And I'm like, no, the adjustments are why you're still hurting, because you're hypermobile, which is creating this rebound response in your body. When you send it past end range, your body guards back up, which is why they're very sensitive to activity, because their boundaries of end range is very, very inaccurate. It's sending wrong signals to the body.
Which is interesting, because I think everybody's experiencing this on some level. And also, now that we've been quarantined for, I've lost track of the days. I don't even know how long. You can't go see a chiropractor or a massage therapist.
Right.
And I remember sitting there the other day going, I really need a massage. Like I really need something that is going to help sort of release the tension in my neck. because whether we know it or not, everything has gotten to us. We are feeling some forms of stress in different ways. Everybody's feeling it on different angles, whether it's job stress or family stress or financial worry, relationship issues. I mean, there's so many moving parts to this situation that we're in. And then what happens is that our muscles take the brunt of it because we coil to protect ourselves. And in doing so, we, cause, knots or, tension. So how can we do things at home? I know you're going to show us on the device, but is there anything that we can do at home that in good practice that you teach your patients of stretching or releasing, like not cracking yourself, but
right. Please don't crack yourself. Yeah.
I don't know why people do that. I find it so crazy. Ooh.
I know, it scares me. But I mean, there's lots you can do. I mean, just like from the very like just simple all the way up to like I'll show you specific stretches and things you can do. Okay. But like while we have this time and while we're home, one of the constant things I'm always teaching my patients is like how to properly breathe. You wouldn't believe how many people like breathe here in their neck. And like you'll know you do this if literally like you'll just all of a sudden be like and like take a deep breath, and it's because you haven't been breathing. And our bodies and our organs and our muscles thrive on diaphragmatic breathing, which is belly breathing. If you've ever seen a baby breathe, right, that is how we are biologically meant to breathe. You see their cute little chubby bubby bellies just rising and lowering. Yeah. And, just, it's like a learned behavior to not breathe like that. And so to really just try to bring your breathing 360, like imagine your whole torso and breathe in this expansive way. Our organs thrive on that. That's what helps, digestion and everything.
So how do we breathe? What?
So basically what people don't realize is when you breathe, when you inhale, your belly should actually protrude.
Yes.
And most people, when they inhale, they suck in and they breathe in their neck and up here. But when you inhale, push your belly out, which is very unnatural for most people. So first thing is when you breathe in, draw your belly out. So inhale and push the air down and out. It's hard to show, obviously, but that would be the first thing. So bringing the breathing down through the body, and imagine breathing like really from the clavicle down, take it out of the neck. And right. That's huge. That's like one big thing. The other thing, obviously, is just being properly hydrated. That's the best thing you can do for your muscles and for the body, because you need that fluid. Otherwise, your body will take it out of the muscles and the fat tissue and everything else to right. supply the vital organs. Because your body will always, take priority to the system. And right. It will draw it out of the superficial tissues, which is the muscle and the fascia and the tendons.
Interesting. Yeah,
that makes sense. Drink water so that your body doesn't have to draw it out of your muscles and your tissue.
Now, for those of you listening out there, you can drink too much water. So yes. Make sure you put electrolytes in your water. Yes. Magnesium, calcium, sodium, potassium. All of these things are necessary. I know I had a patient the other day say she drank like 4 liters of water a day. And I said, no. That's way too much. Yeah. And she was feeling not well. So interesting. Breathing and drinking. Yes. Really 2 easy things to do. Somebody's getting a glass of water right now.
Yay! Let's drink together. Cheers!
Let's drink. Yes. I'm going to drink my vitamin C drink here. So going to that, talking about that, what about supplements for spinous support?
Supplements. Some really good supplements. I also like recommending some like herbs too. I think, and you talk about this too, I believe everyone needs vitamin D. I think we're all deficient. Right now, I think everyone needs vitamin C and zinc, just with everything that's going on. Magnesium is huge for the body. It just really helps the tissue and the cells, you know, really get through that regenerative cycle when you're sleeping. It just assists. We need all those electrolytes to really regenerate the cells and really help your body repair, because that's what, you know, sleeping does. And if we're deficient, that's not happening, and so we're just waking up in this like cycle of non-turned over cells, which manifests in the body as, you know, chronic pain and lack of circulation. So I love vitamin D, I love magnesium, I love vitamin C. I don't know who first brought me onto this, but I also like, for my patients, you know, because I see people who are like pretty stressed out and who have, you know, issues. I have wellness patients, but a lot of my patients struggle with things. There's some herbs, ashwagandha. I don't know if you've heard of ashwagandha.
100%.
It's a really good, it helps you just kind of manage stress. It helps keep your body just less reactive systemically, I think. Maybe you could talk more on it. I'm not a specialist on this stuff by any means.
It helps the cortisol levels. So cortisol is a hormone produced by your adrenal glands. And when you're undergoing, your cortisol should be the highest in the morning and lowest at midnight. Now, some people who are wired but tired, those individuals will quite often have the opposite. They'll be on like European time. So they're first thing in the morning, they're exhausted, they can't get out of bed. But at night, they're wired, but they're tired. And that's the cortisol being the opposite way. What ashwagandha does is it balances and downregulates that inflammatory response from cortisol. Also, things like theanine, which is found in green tea. And that's why some people can drink green tea, but not coffee, and not get anxious, although green tea is very high in caffeine, so you have to be careful. The theanine is also calming and helps with cortisol levels as well.
Yeah, and I mean, I always, you know, tell my patients wherever they can find it, because I just think injections are more effective. Like B12 is great. I also just use, like, I'm not sponsored, but it's the only one that kind of has stuff that I like. It's, you know, just a little tablet, a hydration tablet, just has electrolytes in it. So, you know, if you don't want to like go to the grocery store and get like electrolyte water right now, you know, you can just throw some tablets in. 100%. They're not super common, but you know, we need electrolytes. We need to really get those minerals in our body. And that will help regulate your thirst and stuff too, I think. You know, if you're thirsty and like in this cycle of just snacking, you need to reestablish balance in your, you know, hydration and your minerals and your nutrients.
And where there's pollution, there needs to be dilution. That's my favorite thing. Like if
I love that.
Right? Like if you're toxic, you know, your body's toxic, you need to dilute it. So, you know, and that's super important. The key thing is you mentioned magnesium. I'm obsessed with magnesium. I mean, if I could marry magnesium, I would. I say this all the time.
We're going to fight for magnesium.
Magnesium, it's found in the Krebs cycle. Every single cell in your body requires magnesium. 100%. We're all deficient in it, 100%. And if you're one of those people that pees a lot, like always peeing, you're always rushing to the toilet, you're definitely deficient.
Totally.
Because you're losing magnesium.
Totally.
And so always get on, there's different forms. There's magnesium citrate. That's a good one if you're a bit on the constipated side. And then magnesium glycinate is a nice absorbable one that won't sort of upset the gut and push you to go to number 2.
Yeah, I know. We love a good poop, right, Dr. Nigma?
Yep, I'm all about poop.
Love the poops. So yeah, I mean, other things like I love a good probiotic. I personally take yours, not to plug you, but I love your probiotic. I think if you have digestive things, like a lot of people don't know about like enzymes and probiotics. I mean, you should definitely be taking those stuff if you have digestive issues. Another interesting one, which again, I don't know who turned me onto it, but have you ever heard of marshmallow root?
Yes, marshmallow root is incredible.
I love recommending that. I think it's a really good thing for your whole body from the inside out. It really just like reestablishes, I always tell my patients it's kind of like moisturizing from the inside
Yeah.
out, right?
Well, it helps with tight junctions and leaky gut, and it sort of calms down any kind of mucous membranes in the intestinal mucosa. So that, along with deglycerinized licorice, marshmallow root, really, really, really amazing when I have a patient who has leaky gut, for example.
Yeah. And I feel like so many people these days have that. When I have patients who just sound really reactive, I'm like, you guys gotta find a naturopath or find someone who knows about herbs, because there's stuff out there. It's really effective. And I mean, people are always surprised marshmallow root, like it doesn't taste like anything. I just personally drop it in my water and it's like no big deal. So yeah, those are the big ones. I love a good probiotic. I love vitamin D. I'm obsessed with magnesium. Yeah, I can't think of much else.
There's some new research on vitamin D and COVID, and that it reduces the probability of the symptoms, the severity of the symptoms. And we have to look at vitamin D. It's a pro-hormone. It's an anti-inflammatory. So, and most of us, again, are deficient in vitamin D. And there is some genetic propensity for some people have this VDR, genetic polymorphism difference, and that what that means in English is that you have a genetic propensity towards requiring more vitamin D than the average person.
Okay.
So there's lots of different issues around vitamin D and why people are low in vitamin D. Okay. There were a couple of questions on magnesium causing diarrhea. Yes, if you're taking a magnesium citrate and you're taking too high of an amount, you could get diarrhea. So try to go to a magnesium glycinate. I like the one by Pure Encapsulations.
I love that company.
So anyone looking for a magnesium glycinate. And so again, different brands for different, always, speak to your naturopathic doctor and your chiropractor who can guide you to the right naturopathic doctor or speak to you about supplements because they're very well versed and finding out what you need specifically because we're all different. Although magnesium and vitamin D are pretty much
can't go wrong.
And vitamin C.
Vitamin C, yes.
Because we don't make our own vitamin C.
Right. Also, like for patients, if they like sprain their ankle or if they have like an acute trauma where they have visible swelling or inflammation, I like to recommend bromelain. It's naturally found in the core of pineapple, I believe, and it's a really great anti-inflammatory, and it can really help combat those early stages because you do want to be careful. I don't know how you feel about this, but I try to allow my patients to sort of, when you like sprain your ankle or you do something where you're like inflamed, to not shut it down right away with an anti-inflammatory over the counter because there are like immunity cells in that fluid that help, heal the body and the tissue. And if you take something that chemically pulls that fluid away, you're almost slowing the healing process. And I don't think people realize that. It's just like when you have a fever, that heat in the body is functioning as denaturing cells that need to be killed off. And if you cut that process, first of all, it's unnatural. But when it's chemically removed, you're slowing your body's natural ability to do what it needs to do. Our body is remarkable. And we have all the cells we need in our body. So I always am like, bromelain. I always, turmeric, whatever you can do to just create an environment of healing, not just chemically take it away so that you don't feel the pain. We have pain for a reason.
It's true. So well said. So well said. I want to move on to the this amazing little tool.
Yeah.
Can you explain what it is?
Yeah, I will. But I was seeing, do you want to talk? I feel like people were asking questions.
Oh, yes.
You want to answer some of these and then we'll go into the...
Sure, yeah.
I don't know
Well,
if I can
what do
answer
people
all
need
of
more
them.
vitamin D's? So there's a vitamin D, it's a VDR, it's a polymorphism. It's called a SNP on your DNA. You can get this test done to see if you are more susceptible to having deficiencies than the average person. So it's called a VDR SNP, or single nucleotide polymorphism. And you can speak to your naturopathic doctor about this, because we do a lot of genetic tests to look at looking at epigenomics and looking at where there are propensities towards certain people. Some people get more inflammation. They have more inflammatory cytokine polymorphisms that are elevated, for example, like IL-6, tumor necrosing factor, all of those different polymorphisms that we check. And we check how people detoxify as well. We have like, I mean, this could be a whole talk in of itself. So
100%.
we won't get into it, but there are ways to look at if you're more susceptible. And of course, you can do blood tests from your doctor to see if you're vitamin D deficient. What about if you're diabetic and have sprained your ankle, your soft tissue has torn, then how to take pineapple? Okay.
What was that?
What about if you are diabetic and have just sprained their ankle? Okay. Well, I mean, being diabetics, you're going to have a lower ability to heal. Pineapple, the bromelain that comes from pineapple works as an anti-inflammatory. I'd probably go with something a little stronger. There's something called serrapeptidase, which is a strong enzyme that sort of helps break down inflammation. You'd have to take a really high amount. That's something you should probably have this person speak to their practitioner about. Again, we can give advice. I'm not your doctor. I've never seen this patient before. It's hard to give advice like that, especially with a diabetic person, because it'd be so many other things that are happening. It could be more than a sprain. It could be a broken bone. We don't know. So it's hard to know, but generally speaking, always, always, always see somebody and talk to someone about this for your particular needs. So we're taking an allergy test, as in a food intolerance test. I'm a big fan of that. I love it's looking at IgG, immunoglobulin responses to different foods. Anywhere from 4 minutes to 4 days after eating that food, you're going to get a reaction. And it could be just inflammation. It could be acne. It could be fatigue. It could be weight gain. It could be water retention. I've used it successfully in practice for 20 years, and I love the food intolerance test.
Yeah, I like it too. It's really helped me. I'm looking at one. It says, does having flat feet affect your spine?
That's your question.
Yes, 100%. I actually have very flat feet. If I dip my feet into the water and step on a flat surface, you will see the whole shape of my foot. So yeah, it definitely affects your spine. Generally, if you have flat feet, it means you don't have a strong arch in your mid foot. So what that manifests like in your body is pronated feet, which means if your feet are flat and you have a healthy arch, it's like this. If you have flat feet, you're already pronating, meaning the arches collapse. So that creates tension in the knees and the hips. So you'll generally have like slightly more knocked knees, which will then put pressure onto the hips and can create sacral and pelvic issues too. So it definitely affects the spine for sure. There are exercises you can do to strengthen your arches. DM me or something and I can like give you some really easy stuff to build it up. I've struggled with flat feet my whole life. I was a ballerina and an athlete. I have a pin in each of my big toes. I had a bilateral bunionectomy when I was 15 and I was unable to bear weight for 8 weeks because I did them both at the same time. So I feel you on the feet. I'm a secret foot specialist because I struggled with feet issues my whole life.
Yourself, yeah. Interesting. Yeah. That's so interesting. Okay, we are going to post this on the IG, so don't worry. Okay. So can you tell us a little bit about, obviously, while we're at home, what can we do I know you're going to show us what we can do with the tool. And then with that, you said you started with breathing as being something super important, and water and vitamins.
And then moving, but not over moving. Oh my gosh. Some of my patients are on my Instagram and I'm watching them every day, like work out when I know they haven't worked out at all in regular non-COVID life. And I'm just like, I hope you're stretching or taking a Epsom salt bath or doing something because, you know, create balance. Like it's wonderful to exercise, but also don't like start training for a marathon right now when, you know, so balance. So I'm gonna take you guys on a little walk with me. I'm gonna show you some of my favorite stretches that are pretty universal and simple, and all you need are things that you for sure have in your home. Let me just lift this up a little. Okay, so the first one is a chair stretch. This. So all you need is a chair. So if you guys want to do this with me, grab a chair. And what you want to do, oh dear, sorry. I'm trying to make this work. You want to grab your chair, sit on the edge of the chair. So kind of perch your little body on the chair. And you do want to have a nice curve. You do not want to be like this. You don't want to take that curve out. You want to have an active core. So active core means like pulling that belly in, sucking the belly button in. That supports the spinal column. Okay. And you do want to have a lordotic curve here. And having your feet flat on the ground. Okay. Cutting off my head here. Okay. Having your feet flat on the ground. So then you just want to get your arms. Here's like a quick posture tip. When you're standing, if you look in the mirror and you're just standing naturally, if you can see the top of your hands, your posture is horrible. When you're standing, if you have a proper shoulder and scapular position to allow for good posture, your thumbs should be up, and like the palms should be facing your legs. Your palms should not be facing back. This is a very closed and forward position. So this is what we're combating. So this exercise is called Brugger's. Opening. So what you do is you sit at the edge of your chair so that you can get your hands out in front of you, and you just rotate your palms out and back. And the goal is to get the thumbs facing back. So what this does in your shoulders, this is horrible posture. This is what I was talking about. It's called ape hands because that's look at how it looks. Yeah. Most people are like this. Yeah. So stand in the mirror, and the first thing you can do is just rotate so that your thumbs and your palms are aligned with your outer thighs. That changes everything. Look at my shoulder position just from doing that. Wow. So Brugger's is just bringing it out all the way. So you want to get these thumbs to face behind you. And while you do that, you squeeze your shoulder blades. Wow. Because what most people do, and you just want to hold that for like 15 seconds and breathe while keeping a strong core and just actively. So I'm putting energy through my fingertips and I'm pushing out and squeezing and breathing in my belly. So just doing that is huge, and you'll feel these muscles in between your shoulder blades that you didn't even know you had. And honestly, I just worked out. Yeah, you could get sore from just that. It's crazy. Yeah. So that means that my posture is not good. Yes. Okay, I'm on it. I'm on it, Dr. Chavez. Okay. So the other one is a really cool chair stretch. This is for your neck because I feel like everyone has tech neck. So again, it's just from looking down at your phone or staring at your tablet. Like this is like literally, horrifying for me. Okay, so what you do again, all you need is a chair. Try and get this a little better here. Can you still hear me?
Yes.
Okay. So sit on the chair. You can be like more in the middle of the chair if you need to be, but you want to, with one hand, reach under the chair. So reach under the chair with one hand. You want to hold under the chair, pull your body away, and then let your neck fall away from that side. I instantly feel something pull all the way down. I'm pretty tight. And then what you want to do, and it's very important, integrate your eyes. So start to look away. I feel something immediately go up into my forehead. That's a trigger point for sure.
Wow.
Look down. And then just rotate your head in like half moon, half circles. And the goal is to like draw the eyes up, bring them down. And then if you can imagine your eyes looking down at your hand over here, but using your eyes, you'll get way more muscle activation. Can you feel it, Nigma? Isn't it crazy?
I can totally feel it with my eyes.
Yeah, when you use your eyes, it like turns on that muscle because there's a neurological feedback that's happening.
The other side.
And it literally will release everything from your forearms, your biceps, all the way up to your levator, your traps, and your neck. And you do that on both sides. I'm telling you, it's crazy.
Oh
you can actually see, look at this. This is pretty cool. You can see my muscles.
Crazy. You could be my cadaver.
Yeah.
My live cadaver.
I know, right? But that's huge. And do it on both sides. It gets this whole thing. Like, I literally was feeling like referred pain up into my skull. Like, that's how tight all my stuff is. So another huge thing, like with all this stress, I treat so much TMJ issues because people clench and also are just chatting on Zoom and house party and just like, you know, living their best lives right now with the socializing that we can do. So, you know, easy things that we can do. If you're not talking, your teeth should not be touching. Oh, Dante, let me see. Hi, Dante.
He wants to be part of the stretching.
Hi, honey. So what you can do, if you're not talking, your teeth should not touch. If your teeth are touching, it's activating these masseters and all these integral temporomandibular muscles.
Yeah, which gets
if they're touching, they're activating. So your mouth, like I'm gonna open my lips, but obviously, hopefully you don't like mouth breathe when you're not talking, but maybe you do, I don't know. But you should have a small space and your tongue should rest like just behind the teeth or just under the bottom teeth.
Okay. Interesting. Okay, we have 10 more minutes.
Okay, so should we do the so right stuff?
That was amazing what you just did.
Okay.
I'm so glad because this is something everybody can do at home with a chair. Everybody has a chair.
Yeah.
So now what we're going to do is these lovely gadget that you have, and someone is going to win this today.
Someone is going to win this. Someone is going to win both of these.
Oh my gosh. Okay, great.
Actually, someone's going to win. I'm feeling really generous. Someone's going to win all three of these.
Wow. Okay.
This little mini is life-changing. So what I was saying about the jaws, you can massage the jaw. You can get into the head. You can do it with your fingers. And that can release a lot of tension.
Love that.
Jaw pain refers down into the neck too. Okay, so this is the So Right. So basically it was designed to mimic the knife edge here with a massage or your elbow. So this edge feels a lot like the elbow. So it has like this incredible edge to work with. And what you do is you just get into the body. So it's hard plastic. It literally, like we've thrown it off like a 5-story building and it didn't crack. It's strong plastic, but the incredible thing is it has this beautiful wide edge. So although the material is intense, the edge is really forgiving and it's really powerful. So this was built to release the psoas muscle, which is a huge hip flexor muscle that goes from the lumbar spine in the back and it shoots all the way forward into the front of your hips, down into your hip flexors. So it's a huge muscle that literally attaches from the lumbar spine into the front of the anterior hips. It's a long muscle. It holds a lot of emotions. And basically how it manifests is as low back pain, sciatica, hip snapping, shallow breathing, all kinds of things. So I'm going to get down and show you guys how to use this specifically in your psoas.
I love this thing.
So a lot of people use it on both psoas at one time, but it was technically created to just use one at a time, because not everybody's psoas is this far apart. Like, it actually does fit on my psoas perfectly, but most people will generally have to just use one at a time. So where you want to be, if you feel your hip bones, so you feel the bones right in the front of your hips, you want to be about 3 or 4 fingers in from that bone. That's about where your psoas is. So you do not want to be on the bone with this thing. And then I'll just get down and show you what it looks like. Okay, so you slowly lower your body, and you literally just lay on it. And this is kind of crazy because even massage therapists tend to not get in here. It's like a very, very neglected muscle that is super powerful. So you lay on it, you breathe. I go all the way up to follow it just under my ribs. And again, you don't want to be on your bones. So I'm not on my ribs, I'm just under them. And I'm just on the inside of my hip bone. And you can use your leg to bring the muscle out more. You can turn it out to get more of the hip. You can rotate the leg up and out. And you just want to do both sides. And it literally feels incredible.
I'm just showing everybody what you're leaning on.
Okay. And you can just do this like several times a day. You really can't overdo it. With that being said, you should never bruise from it. And if you can't take a breath comfortably, then back off on the pressure. If anything is numb or tingling, then move where you're going because you're on a nerve or some sort of blood supply. So you do want to be mindful with everything that you're doing. If you're feeling a sensation, your body is communicating with you. So work with your body on what feels comfortable. So that's the So Right, this guy. The newer one that came out is called the So Spine, which of course I love because I'm a little spine lover. So it's the same sort of edge. It's just much smaller, and there's pairs. So what you want to do is get your spine in the middle of these edges. And to start,
You do it in your chair?
yeah, I do it on my office chair for sure. It's awesome. I put it in my car, but it might be a little aggressive for people. Because if you go on speed bumps or like the little jiggy-jaggy on the freeway, it's like a little built-in massage.
Yeah, wow.
But that might be a little intense.
So good, honestly. But
like,
you're going to show us on the wall how to do it.
So we're going to start on the wall because that's like the most user-friendly. So there's little stoppers in there clear so they won't mess up your beautiful walls. No worries. So just place it on the wall, and what you want to do is just get your spine in the middle of these peaks. And honestly, so because I'm an athlete and I grew up exercising, you should always warm up. So you don't want to just go all in. Just start by lightly rubbing. See what feels tender, what's going on with the body. Once you kind of warm up a little bit, I always tell my patients to do wall angels. So you just sort of bring your arms out to 90, and you can lift and lower, and it just gets in those muscles in a more active way and helps engage good posture muscles. You can bring it down into the low back, and again, I'm using my core to push against. You can bring your arms around, go side to side to just get in any area that feels a little stiff. You can also just do little micro extensions on it if you feel locked up somewhere. The other thing I kind of like on this one, because I'm a runner and I like to cycle, put it horizontal and you can get into the glutes. That's really good. Gets all around the sacrum. I like to do a lot of movement. I like to do a lot of active release in my practice. And so
Can you sit on it as well?
You can sit on it, yeah, totally. So what I was gonna say is, on my Instagram, I have 2 IGTVs right now that go over how you can also use this. Both of them you can use all over your whole entire body. Amazing. But I'm just showing you how they were specifically used. This one specific to the spine, this one specific to the psoas, but they can be used all over. And if you want to buy one, if you don't win, you just go to PSORITE, PSORITE.com or PSO_RITE for Instagram. And you can buy one. They're on sale right now. It's a super great deal. And I think I also have an additional 10% off if you use Dr. Susie 10. I think you'll get 10% off of the sale price. You can get them for like $50 or $45 right now. They're regularly $100.
Oh wow, that's great.
So it's literally a great deal.
And then last but not least,
so key. That's so key. Yes, for your job. I also use it in my hands.
Oh.
And you can get like in your thenar, it just gets inside all those little nooks and crannies. And I like to get it in the forearm, all these little, to kind of separate all the muscles.
You can use it everywhere. I love this.
Yeah.
Do you just go like that?
Yeah, you just sort of rub that. I like doing cross friction. It's a really good way to release the whole length of the muscle. If you find a tender spot, just kind of hold it there and maybe like experiment moving.
Oh, it feels
it's always
so
good to
I mean, this is like really, really amazing.
I'm obsessed with this. I keep this like in my center console in my car, and I'm just like constantly. You can get your chest because everyone's chest is shortened. Oh my gosh, because everyone's this. So you literally can just start rubbing and getting blood flow. I mean, if nothing else, if you're like a tender body person, just rub your body with this lightly. It will stimulate blood flow.
Amazing.
Yeah.
It's just good to know little gadgets like this. Like, this is not an ad. I have no affiliation with this company. I just want to give out information to people that, you know, while we're going through this and we can't really get to anyone, what can you do at home? The chair exercises were brilliant.
Yeah, those are really good for your, because posture and neck, I feel like that's major right now. Yeah. A lot of people have low back pain too, but I feel like your neck and your posture is just really being compromised right now.
So much.
Everyone's obsessed with their tablets. It's all we can do right now to connect.
I know, exactly. Oh my God, this has been so amazing, Suzanne. Thank you so much for joining us today. I cannot believe the hour went by like
that. I know. I don't even know if we like chatted about everything. There's so many other things I do, but maybe we can do a part 2 or something.
Yeah, we could do a part 2 for sure. Thank you everyone for joining. Don't forget to go onto my Instagram and Suzanne's Instagram. Follow the protocol of what we're asking to do. You're going to follow her, follow me, tag a friend, and you obviously were watching us live here to know this. And thank you, Candace, for bringing us together.
Yes.
You're such a connector. We love you, Candace.
Thank you. We love you.
And everybody have an amazing rest of your day.
Yeah, and if anyone has questions, if I know there was questions we didn't get to, DM me and I will answer them. I'll give you, you know, whatever exercises or recommendations I can within, you know, the parameters of my scope. And I'd love to help anyone I can right now. It's my pleasure.
Oh, you're the best.
Yeah.
Thank you, guys. Thank you, Suzanne.
Thank you. Bye.
Let's love everyone. Bye.